Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle. This is Dr. Tom Roselle Live in studio. I'd love to talk to you on any subject that you have in mind, even the rain outside. Gee, can't we get rid of this stuff? Give me a call, 888-630-9625. That's 888-630-9625. Let's chat about whatever you'd like to talk about today. I've got a couple things I want to run by you. But more importantly, I'm going to invite you today to join me right after the program. I'm going to be at the Pathways Natural Living Expo over at the Bethesda North Marriott on Marinelli Road in North Bethesda. Join me at 2 o'clock. I'm going to be lecturing from 2 to 3 o'clock. Stop by our booth, say hello to my staff, ask them questions. But listen, what I'm going to talk about is simply this, my special topic, Ageless Health. You know, you are at a place in your life relative to your health that what you got is what you got because you did what you did. You know, health is a do-it-yourself program, right? The title of my book. So if you want to change something, you've got to take control. So that's what we're going to do this afternoon. I'm going to talk to you a little bit for an hour about this very specific, very right now subject, your health, how it is at this moment in time, what you can do about it, how you can change it so you too can have something called ageless health, wellness, the maximum expression of your body's capacity to do its thing. So join me at 2 o'clock. As soon as we're done, program's done at 1 o'clock, go over to the Bethesda North Marriott Hotel, 5701 Marinelli Road, North Bethesda, and I think I'm in Salon G. So it shouldn't be hard. The place is packed. There's going to be all kinds of people there. You're going to have everything from books to people who are massage therapists, and I mean it's a really cool place. They've been doing this for like something in the neighborhood about 39 years. If you haven't been, it's really an interesting experience. But I'll be there, and more importantly, you be there, and we'll talk, and we'll have an opportunity to chat with each other, and kind of get into the intimacies. I'll stay as long as you want. We'll hang out in the hallways or whatever you want to do, and discuss your problems. But let's discuss them here. 888-630-9625, and let's talk about things that bother you. One of the things I want to get in today, we've kind of had a topic every time that I've been on the program over the last several weeks, several months, and it's called stress and how the body begins to break down. From the way we look at things structurally, chemically, and emotionally. There's either injury to the body, there's biochemical imbalances, there's stress, and all of those things cause you to either have really, really great health, or they cause your health and your capacity to go right down the sewage system. So, what does that mean, and where does it start? Well, generally, we look at the nervous system as the master connector of all of this stuff. And when you look at the nervous system, that's your electrical system, that's your energetics, that's your transformer, that's the guy that, gives you the juice to do what you want to do. And to ignore that piece, because you want to focus on your nutrition, to ignore that piece because you think you're all stressed out, really takes away from the salient idea that your body is not connected, and it is connected, and is directed, and it has to have the juice to make it work. So let's talk about that for a while. Let's talk about those automatic things that allow every piece of your body to stand up and do what it's supposed to do. That's called your nervous system, right? So brain, and spinal cord is where it starts, above, down. Everything starts in the brain, goes all the way down to your body, goes out to the muscles, goes out to the organ systems. And there are things that you can volitionally do. You can decide, I'm going to pick up that cup and I'm going to lift it up to my lips and I'm going to take a sip of water. Or the things that you automatically do no matter what. Your heart works, you breathe, your kidneys filter, your liver works, your muscles keep a certain amount of tone in them. You have an immune system that fires and works. All these chemical messengers that connect one system to the other. You get a fever when you get an invading pathogen. A bug comes in your body, so you got to get rid of it, and we try to suppress the fever, which is a mistake. Sometimes our guts cramp, and we have to, run to the porcelain throne, and that's a body's automatic system as well, trying to get rid of something that shouldn't be there. Communication among our nervous system and what we call the neuroendocrine system, neuro meaning nerves, endocrine meaning the organ systems, and immune system, are in sync, right? Nervous system, neuroendocrine system, they're bilateral systems, and they have to stay balanced. And, they have internal and external exchanges relative to communication. So the ability to maintain balance within the body is essential. So if you're out of whack, right? You're not eating the way you're supposed to, or if you limping along with injuries and you kind of you never really feel good, or you're constantly in a state of angst, you don't sleep because your brain won't shut off. All of these things begin to destroy the body's effort to maintain harmony or equilibrium. The control centers that kind of are the conductors of this neuroendocrine system have to do with those guys that are located in the brain. It's called the hypothalamus. The hypothalamus is a little guy that is the orchestrator. He's the conductor. He tells everybody what to do. And it's considered one of the most primitive parts of the brain. It's been there like forever, since if you're an evolutionist, well, when the first creatures were here, they had this hypothalamus center and it began to develop in a very sophisticated way, but it's still there and it's still part of the old, what they call the old brain. But don't make a mistake, that this primitive system, this is simple. It's not. It's very sophisticated. Other parts of our brain are associated with, rational thought and intellectualism, and that's also called, the so-called primitive brain ensures our survival, and we can work through systems and so forth. And there are certain pieces that are less important, other that are more important. But nevertheless, when it comes to you're protecting yourself, we're talking about the nervous system and its automatic functions, and there really are, there's a very salient way of following this thing and making sure that you get what it is. So let's make sure we understand it. We're talking about things that are automatic. You can see. You don't think about seeing. You just open your eyes. If you can't see, it's an unfortunate situation. You breathe. Your heart beats. Your kidneys filter. Your liver filters. You do all those things automatically, right? So to make sense of what happens, so you understand that your body has to constantly restore balance, and it does it through this automatic system. So we have two pieces of this automatic system. We have something called the sympathetic nervous system, and we have something called the sympathetic nervous system. Why am I spending time on this? Well, like every other program, something usually triggers me to discuss a process with you. And everybody thinks that the body is compartmentalized, that you can only look at one thing and it works that way. Well, not so much. And you have to understand that when, for example, you sweat, it's not because it's hot outside. It's because your body's doing something to try to cool you down or to try to get rid of toxins in the body. So we go out and what do we do when we sweat? We put all kinds of powders on, we put these antiperspirants on, and we try to stop the sweating process. Not a good thing, because the cells of your skin, when they're sweating, open up, and now you're putting all this junk into the system. So there was a patient that came in the other day, and she had been very sick for a very long period of time. And very nice lady, very sophisticated lady, but she used all kinds of deodorants and powders and perfumes and so forth because her sense of who she was maintained on to make sure that she presented well, meaning don't smell, don't sweat, make sure that you don't even have a little perspiration. Well, she was absorbing all this stuff and then compounded on everything else that had taken place. But here was what happened. She had a car accident. And the car accident was about 20, 25 miles an hour that she was hit from the rear end. First blush, not a big deal, right? Well, with the exception that now this car accident was compounded on top of things that weren't already right. She was already suppressing the biochemical system in the body. She was actually irritating it. She was already in a postural situation at work where she was constantly at a desk, wore heels, which is going to shift the structural pattern. Now you got this blow from the back where your head goes backwards, your body goes forwards. There's a stopping of the accident at one point. Now the head continues to go forward and the body stays in place. So that's why it's called a whiplash. It goes backwards and then forward and then forward and then backwards. It's whipping around. But so she damages the lower portion of the brainstem. And as a result of that, all the nerves that come off of that brainstem at a very low impact, 25 miles an hour, are now affected. So there's one nerve that comes off that is the longest nerve in your body. It's called the vagus nerve. And the vagus nerve is like a big, big conduit. And it affects the heart and affects the lungs and affects the stomach and affects the liver and affects the intestinal tract and so forth. Yeah, it goes all the way down. It has branches all over the place. So she irritated the lower portion of the brainstem, the upper portion of her neck in this accident, and now she has huge digestive function problems and an inability to get rid of toxin because of all these other things. But this was the straw that broke the camel's back and just caused everything to collapse. So she walks in and she says, not only I don't feel good and I'm in a lot of pain, but I feel like I'm falling apart was the words, and I'll use those. So this whole paradigm, she had gone to, literally before she saw us, about 6 different people, and they had given her this medication, making it worse, and that medication increasing the problem. They sent her for some basic physical therapeutics where she had massage and she had different types of modalities. The massage made her worse. Why? Why would massage make her worse? Because as the massage therapist, not doing something badly, and massage therapy is a great thing, was pushing the toxin back into the body. And her body didn't have the ability to get rid of it. She didn't have enough straight out water to flush it out. So now you see the compounded effect over a period of long time that caused this person to be sick. So let's talk about fight-flight. Let's talk about sympathetic versus parasympathetic. So let's make it real simple. Sympathetic simply means go out and handle the tigers in the field. Start protecting yourself. Fight. Run. Get your heart rate going. Increase your blood pressure. Increase muscle tone. Okay, it's all protective mechanism. That's what sympathetic means. It goes in sympathy with you to be able to protect you from the constant insult of your environmental stresses. Today's world, we're not necessarily being chased by tigers, although in some places I guess we are. But we are being constantly insulted by things that happen. The flaring, if you will, that we have back and forth with somebody in our work or our children or our husband or our wife. And we get upset, or we feel that we're in jeopardy. If you're in a car, some crazy person around here decides to not put on their turning signal, or they turn in front of you instead of staying in their own lane. That's a fight-flight reaction. It's constant. If you're in pain all the time, that your body's ability to handle that pain is part of the sympathetic response, and subsequently it causes your body to be far worse than what it is now. And you end up with high cortisol levels. Cortisol increases the sugar production. It can't go anywhere. It gets stored. You put on fat. It's called cortisol weight. And we see our body begin to break down. So that's sympathetic. What's parasympathetic? If parasympathetic is working the way it's supposed to, you get to digest your food properly. You get to sleep longer. You repair better. It's a calming process. The digestive system works the way it's supposed to. So you have parasympathetic and you have sympathetic. And I'm going to tie those together for you. I'm going to tell you why we're talking about those, and we're setting this all up for something very, very important when we come back after a break for some very important information. Don't forget, after the program, join me at the North Bethesda Marriott Inn. I'll tell you more about that when we come back. This is Dr. Tom Roselle, Don't go away.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education. Join Dr. Tom Roselle for a movie viewing of Ageless Health, the special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, the special, showing at the AFI Silver Theater in Silver Spring on Sunday, May 4th at 2:30 p.m. For tickets and information, visit agelesshealthmovie.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. It's rainy outside. It's kind of, what happened to the weather? It's supposed to be warm. It's supposed to be, typical Virginia, Washington, Maryland, springtime. Warm, nice, sunshine. I think it followed me down from Western New York State. I'm sorry. I apologize. It's, that's what happens. They finally found me. Talking about parasympathetic, sympathetic problems in the body. What's that? Your fight-flight system opposed to your body's ability to rest and repair. It's critical. It's one of those things that if we mess it up, we have a whole Pandora's box of symptoms, from fatigue to itchy, burning eyes to white-coated tongues, allergy reactions, ulcers in our stomach, GERD problems, pain patterns that just don't go away, that chronic fatigue and chronic pain, the fibromyalgia, all those things. When somebody's in a state of parasympathetic overdrive, you can look at them and you can tell, because what happens is their body is going into kind of a failed situation. They have constricted pupils of the eye. Their secretions of their saliva, they're always wet. They always have a wet mouth. The heart rate decreases, and subsequently the blood pressure goes very, very low, and it goes sometimes too low where they get dizzy all the time. The airways are beginning to get restricted because the bronchial tubes tighten down. The digestive system is always being stimulated, so you have increased peristalsis, movement of the gut, but you also end up with increased digestive juices, and that's what in many cases produces the GERD. The urinary system doesn't do what it's supposed to do, and so forth. And sometimes incontinence, both ends of the body. So not a good thing. When you're sympathetic, your fight-flight system, then you see the heart rate goes up, your blood pressure goes up, it dilates the bronchial tube so you can run faster, get away. That's when you see a little old lady that sees a child underneath the car, and she's 98 pounds, and she picks up the car and saves the kid. She breaks every bone in her body, but nevertheless her muscular pattern will allow her to do that. That's adrenaline surge. It comes from this sympathetic overdrive. We're talking about all of those problems that affect you, no matter what they are. You can name them, and we can take it to this parasympathetic sympathetic response. We're talking about the neuroendocrine system, the way the nervous system affects all the organs in your body, whether it's your heart or your intestinal tract or your kidneys or your bladder. It starts here. And we're talking about the three primary stresses that affect these guys. structural stress, meaning that you've taken a blow or you're out of shape or your body's not working the way it's supposed to, so it affects the protective mechanisms of the spinal cord. We're talking about the biochemistry, things you eat you shouldn't, things that you need more of, you don't get enough of, all of that junk. And then third is emotional stress. The body doesn't know the difference, remember, between something that actually happens and something that you think about. So, and some of us don't think really well. So let's pick this apart. And by the way, this afternoon, like I said, when I'm done here, I'm going over to the Bethesda North Marriott Hotel. It's located on Marinelli Road, and I'm going to be speaking at the Natural Living Expo at 2 o'clock. Love to have you join me. I think you got to pay $10 to get into the place, but my lecture doesn't cost you anything, so come on over and join me. I'm in Salon G. It's going to be an hour presentation. Love to meet you, and we're going to talk about Ageless Health. We're going to talk about how you can, at any part of your life, increase the ante so you're doing extremely well and begin to reverse the process. So if you really want to know how this stuff all comes together, here's an opportunity. This afternoon, 2 o'clock, right after the program, meet me over there, Bethesda North Marriott Hotel on Marinelli Road, and we'll get a chance to talk about your problems intimately, one-on-one. I want you to go to our website as well. Go to rosellecare.com, ROSELLECARE, and I want you to check it out because we've added a couple things. I'm not going to tell you what they are, but I want you to go in there and look. Let's talk a little bit more, which we did about a week or so ago, about something called the HPA axis, the hypothalamus pituitary adrenal, because this HPA axis is compromised any time that there is a stress pattern and then subsequently affecting this mechanism we're talking about, this parasympathetic, sympathetic phenomena. And when we have that hypothalamus, pituitary, adrenal, and then remember we talked about thyroid. Well, the thyroid and the adrenal glands are the two major organ systems that are beat up constantly in any kind of primary stress situation. In the past, I've covered many ways of, checking the adrenal system out and talking to you a little bit about your thyroid and what happens and, heat and putting on fat and so forth. But there's a ton of this information that is by itself doesn't mean anything. You got to put it all together. You got to work it hand in hand and understand that it's structural, chemical, emotional, and then it affects, because of those imbalances, this fight-flight phenomena, this parasympathetic, sympathetic. You get into my class this afternoon, we're going to talk a little bit about that. We're coming up to a break, but I want to encourage you. Next part of the program is for you. 888-630-9625. That's 888-630-9625. Give me a call today. Let's talk about your problems. Let's see what we can do to put it together. Maybe I can kind of turn it around just a little bit. You know what? And your health will improve. Don't go away. This is Dr. Tom Roselle. We'll be right back. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. It's raining outside, but there's sunshine in your heart always. I mean, you can change that anytime you want to. I'm here at 888-630-9625, 888-630-9625. Love to talk to you. We're talking about stress patterns, and we're talking about how the body's nervous system reacts from a place of protection, which is called the sympathetic system, to the place of relaxation and repair and restorative processes, which is called the parasympathetic system, and how they should work. But unfortunately, when you're under stress all the time and you're unbalanced in one area and you're constantly going into rage, or you're constantly in pain, or you're eating things that you shouldn't be, so your body has to defend itself, you shut the rest of it down and there's no restoration, there's no fixing the problem. Join me this afternoon right after the program, 2 o'clock, at the Bethesda North Marriott Hotel on Marinelli Road, North Bethesda. We're going to be at the Natural Living Expo. 2 o'clock, I'm going to present, and I think I'm going to be in Salon G. So let's do it. Let's get together, and let's discuss a few things, your stuff. We're going to talk about electromagnetics and all those things that you have, all those devices, the cell phones, the iPads, television screens, things that affect you from day to day that you don't even know that you're getting destroyed with. Well, we'll talk about that in a second. Let's go to the phones. Hi, this is Dr. Roselle. How can I help you? Hello?
Hello?
Hi.
Hi, I'm anonymous.
That's fine. I'll just call you Mrs. Anonymous, okay?
Thanks.
You're welcome.
I'm postmenopausal, but I sweat between my buttocks.
Okay.
And it's very embarrassing because if I get up from the seat, there's like water or dampness there. And it's just terrible. What can I do?
Well, let me ask you a couple quick questions. First of all, how long ago did you go through menopause?
5 years.
Okay. And did this start before or after that?
After.
Okay. So any kind of sweating, whether it's in an area that is between the gluteus muscles of the buttock cheeks, or it's under the arms, or is general body perspiration, any of those things can be a insult to the thing that we're talking about right now, the parasympathetic sympathetic nervous system. And we're getting into that, what we call the HPA axis. See, in this country, unfortunately, women go through a very difficult transition. They go through a very difficult perimenopause and menopause, where in most of the other parts of the world, it doesn't happen that way, because the adrenal glands, those small little ductless glands that you've heard me talk about many times, sit on top of the kidneys. Their job when you go through menopause is to take over for the ovaries and begin to put out the hormones and keep them balanced, to balance the estrogens and the progesterone, and making sure that there's adequate testosterone as well for the body to react. You're going into a sympathetic response because the body's still in overdrive. My guess would be if we did a quick hormone test on you, we'd find estrogen levels too high and we'd find progesterone levels too low, and they would be in relationship to each other. So what you have to do is you have to see what that really is, and then the next question is, why is that? How come that they've happened? It's not just a take this pill and fix it type of thing. It's you look at your dietary patterns, and I'm going to give you a broad brush. Obviously I don't know your case intimately, but you can, if you eliminate sugars, if you eliminate gluten products, if you start drinking a lot of water, increase your vegetables so you're getting at least 8, 9, 10 servings of vegetables a day. A serving's a half a cup. It's not that much. You get a couple big salads and you've got 4 or 5 servings already with all kinds of stuff in it. Making sure your protein levels are adequate and you're eating on a regular basis and you don't drop your blood sugars. If you're not sleeping through the night completely soundly and waking up refreshed, it tells me that your blood sugars are crashing, and so you're going into a nocturnal hypoglycemic situation. So just starting with that can make a difference. Now, if there was injury on top of that, now the area of your body you're talking about is controlled by the nerves that come from the low back, particularly lumbar 4, 5, sacral 1, 2, and 3. That controls that whole pelvic girdle, that whole pelvic area. And if the nervous system isn't working the way it's supposed to, then it's going to increase the sweating process. And it can be very specific to that area because of that. So you have 2 things going on. You have neurochemical imbalance, and you probably have a neurological irritation from old injury, or it may show up as back pain, it may show up as leg weakness. It could have shown up before you went through menopause as very bad periods or bad menstrual cycles. So it's we'd have to look at all of that, but it's fixable. It's not something that you have to live with, but you have to understand the underlying matrix, the underlying mechanism with that. So I hope that helps a little bit. I appreciate the phone call. Join me this afternoon. Come up and introduce yourself to me at the Marriott Hotel this afternoon and say that you are Mrs. Anonymous, and we'll have a chit-chat. Sarah, how can I help you? Thank you.
Yes. First of all, I want to ask you, the conference center and the hotel, are they in the same building as the hotel?
Yes, they are. It's a big place. Right. I was there this morning to make sure my staff was all checked in, and it's a big place.
I live in Bethesda, and I know that the Marriott is on Pooks Hill Road. That's why I was asking my question, not Marriott.
No, it's actually on the corner of Rockville and Marinelli. And you may be thinking of another hotel, but it's right there. I just left it a little before I came to the program. And so if you're on Rockville, you turn on to Marinelli, and it's right there. And the parking is in the back. But if it's full, there's parking across the street.
All right. Now, I do want to ask you, does acupuncture help ulcerated colitis in any way?
Absolutely. Matter of fact, let me tell you a quick story. When I was an intern, one of my first patients was a young man with very severe ulcerative colitis, very severe bleeding colitis. He had literally 35, 36 bowel movements every day, and they were all bloody, and he was thin. This is a man who was about 6 foot or plus, and he weighed about 130-something pounds, so he was skinny as a rail because his body wouldn't absorb anything. And he was being treated in the clinic in Chicago, and he had nutritional care, he had chiropractic care. But it wasn't until that we started using acupuncture with him that we were able to begin to reverse the process. But we treated him at that point cooperatively, even then, and his body began to turn around, and by the time I left, he had put on something in the neighborhood of probably 20, 25 pounds, which was significant, and was progressing. His bowel movements were down to 6, 7, or 8 a day. So the short answer is, we know a whole lot more about it today than we did then, and we've had many patients over the years that have had that type of problem. So yes, Sarah, absolutely it can help.
Yeah. Well, I'm 85. Do you think I'm too old for the acupuncture?
Honey, are you still breathing?
Yes, of course.
Okay, so guess what? You're not too old.
Yeah. And the only thing my doctor has done for me was give me
steroids?
A prescription for lactulose.
Yeah.
And that's it. I'm not on any medications.
Well, you're lucky. The drug of choice is either a corticosteroid or something called zolpidem, which is a cousin, and none of those guys work very, very well. So, yeah, come see us, or come talk to me, and I can give you some more direction. But you can be helped, Sarah. You're not that old. Okay.
Okay. Thank you so very much.
You're welcome. Thanks for calling. 888-630-9625. 888-630-9625. Let's talk about it and see what we can put the fix on. Don't forget, join me this afternoon. Love to talk to you. Love to shake your hand. And let's get into this Ageless Health thing, what it really is, and ask me whatever questions that you'd like. And, let's see if we can make a difference for your life. The thing of it is, and I was playing a little bit with Sarah, but the truth of it is, as long as you're on this planet and your heart is working and you're breathing, your body has the capacity of reversing anything. It's just a matter of a decision. Do you want to do what it takes to fix it? Are you willing to make some changes? Are you willing to stay the course? Are you willing to exchange a habit for better thought process, feeling better, less pain, high capacity where you didn't have that before? Are you willing to make that shift? If you are, then the answer is absolutely yes. Because, see, every cell in your body is going to die. And whether you live to be 130 or you only have a year or 2 or 3 left, cells replace themselves on a daily basis. So if you do something different than you're doing now, the cells that will be produced are going to be different than the ones that you produced yesterday and 2 weeks ago and 10 years ago and 5 years ago. Because where you are right now is because of everything that you've done up until now. Does that make sense? I mean, think about it for a minute. Think about all the choices and decisions that you've made up until now. It's never too late. It's only the thought process that gets you to a place where you think it's too late. So you can be fixed. 888-630-9625. We're talking about parasympathetic, sympathetic reactions. Let's talk a little bit about a category called electromagnetic stress. We put it into the biochemical side, but it's really bioelectrical as well. So we've talked about it many times before, and if you've been to any of my classes, I say, listen, those cell phones are going to kill you. We already know, and manufacturers know too, because if you buy a new cell phone and you look, there's a warning label on it, and it says that this can cause, there's evidence that it does cause tumors and cancers and so forth, and it breaks, and particularly with little kids, mom and dad, grandparents, you're putting these kids on cell phones and devices early on, and they put them up against their head. They don't have the integrity of that brain-blood barrier that you do, and you're going to have problems. So it breaks it down even faster. And then we get these iPads and these devices, and they put them, in their shirt pockets or their back pocket, or they put the computers on their lap. They're frying their gonads. They're frying them. They're not going to be useful, or they're going to give birth to children later on. They're going to have all kinds of problems. We don't realize the damage that we're doing, and we continue to support technology unabated without realizing that we have to make sure that we protect ourselves. And by the way, there's ways of protecting your family, yourself from that, and sometimes it's just a matter of don't have the stupid thing on your body all the time, unless you really want to cause yourself some problems. But let's talk about these electromagnetic subtle stresses, these subtle energies, these vibrations that begin to break us down. And you have to remember one thing. You are an energetic field. See, every cell in your body is made up of atoms, and those atoms spin, and they cause an electrical field, and then we have this huge electrical sensitivity that is encompassing of all of that. And so it can be influenced by external energetics, and it can be influenced by all the things that increase it or decrease it. So all matter, as we understand it today, is comprised of highly organized energetics. So when we look at it and we analyze it, it's the tiniest components of matter have been put together in ways that they are life supportive or life destructive. So if these bundle energies are organized in a very, very balanced way, then life is in a good place. If they begin to be aberrant or not equal to what we have, then the frequencies are off, and our body's going to break down. It's the same type of thing. Medicine knows about this, okay? It knows about it because they use something called MRIs, or magnetic resonance imaging, to be able to take pictures of your body without radiation. But they do that by lining all of your electronics up in your body. All of your cells, are in a linkage, and then they take a picture. Now, you have enough of these MRIs, and you're going to have some problems. And we see patients that present, I'm going to go in for an MRI. Really? Well, it's better than a CAT scan. Well, maybe. But it still has a problem. It still causes the body to shift electrically. Let's go to the phones. Charlotte, how can I help you? Thank you for calling me.
Hey, Dr. Tom, I'm having a gallbladder flare-up.
Okay.
And so I'm just wondering what I can do for it, or what's my next step.
Okay. You've had problems in the past?
No, this is all new.
This is the first one for you. Okay.
Yeah.
So the first thing you have to do is you got to change your diet. And
my diet's clean.
Okay, well, you want to get down, if you've got a gallbladder issue, what you want to do is you want to go to vegetables only for a few days, and some white fish, and maybe some free-ranged white meat, chicken or turkey, and baked or broiled, nothing else. You want to take the stress off. And so you don't want them raw, but you want them partially cooked or juiced. Don't put any oils on them, and basically don't season them, with the exception of you can use a little garlic, you can that sort of thing, but otherwise stay away from it. Your diet's got to get really bland and really alkaline very quickly. The other thing that you can do is if you have bentonite, which is a powder, it'll start pulling some of that out. If you want to force the gallbladder to open up, go get some organic apple juice and warm it, and drink about 2 to 4 ounces about every other hour for the first 24 hours, so you're going to get quite a bit in for a couple days. That's going to soften whatever's in the gallbladder. If there's stones in there, one of the things that you want to do, and you wouldn't know that right off, is you want to do some magnesium, either magnesium chelate or magnesium glycinate, and I would start taking about 200 milligrams, and I would do that about 4 times a day. Now, the side effect of magnesium is a loose stool. If you get too much of it. You may not. A lot of people can handle a lot of it. Some people can't handle much of anything else. But if that's good anyway, because what it's doing, it's causing the gallbladder to dump. That's why you get the looseness of the stool. The liver and the gallbladder are what cause peristalsis in the body. So if it's jammed up, one of the symptoms of a gallbladder problem is constipation. So do those things, see if it works, and if you still need some help after about 48 hours, send me a note, and I'll tell you the next thing to do. Does that work?
All right. That'll work. Now, the other thing is the intestines are also inflamed at the same time.
Yeah, it's going to. My guess is that anytime you have a gallbladder problem, most gallbladder problems are a result of an allergic reaction other than a calcification. So do that first, and then let me know. Charlotte, I appreciate the phone call. We're coming up to a break. And, again, I'd like to encourage all of you. Love to meet you. Join me right after the program at the North Bethesda Marriott Hotel in North Bethesda on Marinelli Road. It's right near Rockville Pike and Marinelli Road. I'll be there. Hope to see you there. We'll be right back. Don't go away. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle Web Store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle Web Store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Join Dr. Tom Roselle for a movie viewing of Ageless Health, the special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, the special, showing at the AFI Silver Theater in Silver Spring on Sunday, May 4th at 2:30 p.m. For tickets and information, visit agelesshealthmovie.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, 888-630-9625. We're here every Sunday at 12 noon, right at the same old place on your dial. So tell your friends, make sure that you pay attention, and, you know, it just makes your life a whole lot better. I'm going to be at the Bethesda North, the Bethesda North Marriott Hotel as soon as I leave here. And at 2 o'clock, I'm going to be presenting the topic Ageless Health, but it's going to be a very, very specific piece of the Ageless Health topic that we do all over the place. It's on Marinelli Road, right on the corner of Marinelli and Rockville Pike. So join me. Love to meet you. Love to say hello, and let's chat a little bit. It'll be fun. We had a caller just a little bit ago talk about gallbladder problems, and I had a break for the news, and I wanted to tell her there's a couple of things that she can do in addition. Turmeric is a great anti-inflammatory, and about 300 milligrams 3 times a day usually will help break down the inflammatory response in the gallbladder, but she still has to do the dietary things. Also, artichoke and artichoke extract. Artichoke is universally tried. It's been studied at a lot of different medical institutions, and it really helps support gallbladder and liver function so you don't get all that clogging up in there. It thins out the bile. And just good old peppermint tea. So make yourself a cup of hot peppermint tea. That'll help. But you got to clean the diet up. Even though that you think your diet is good, it may not be as good as what you think it is. Bernice, thank you for calling. I got a question for you. Are you calling from Arizona, really?
Yes.
Wow.
I saw your videos on YouTube, and I just love to hear you. So I found out the number and watch you every Sunday.
Well, thank you very much. I appreciate it. That's very, very nice of you.
Yeah.
How
I
can
have
help
a
you?
question. It's for an 89-year-old friend of mine. She has an ulcer on the bottom of her foot. She's diabetic, and she also has a red. Her leg, like where a piece of meat fell out of the freezer and hit her in the ankle, and her leg is red. It's been that way like 6 years, and I think it's called cellulitis.
Yes.
Is there anything that can be done for the ulcer and the cellulitis?
Yeah, you have to start from the inside out. The reason that she's breaking down is because the environment of the body isn't what it should be. And so she probably has some microorganisms that are in the system that the body's it's storing in different cellular tissues. So she's got to get to somebody who really understands the process of how to treat this. But you got to clear the gut out. You have to clear the lymphatic system, see if there's bacteria, microorganisms that are living in there. There's some really good people out your way. Bernice, do this. Get a hold of me on through my website, drtomroselle.com. It's drtomroselle.com. And send me a note, and I will send you the names of 2-3 people out in Arizona that I know very well. And that I would make that referral, because it's not something that she has to live with. Unfortunately, in older people, we see a lot of stagnant problems that can be eliminated. For example, when somebody, as we get older, sometimes their heart tissue doesn't work because they're on medications and so forth, and coenzyme Q10 is a problem. But also cardiac failure, which shows up as swollen ankles and breakdown of tissue, similar to what you're describing, but the ankles will get larger, is a vitamin B complex problem. And if you give an older person coenzyme Q10 and vitamin B, it changes everything. Bernice, I'd love to get into this. Send me a note, and I will give you the data that you need to have, and it can make a huge difference for her. Thanks you. I appreciate your call. Thanks for listening. You know, you're great. Don't forget to join me. I'll be leaving here just in a few minutes. I'll be at the North Bethesda. I'm sorry there's several more of you online. You've got to start calling earlier so I can take your messages. See you in a little while. This is Dr. Tom Roselle. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.